My first real management job was in the School of Medicine at the University of South Florida.
That's a tough way to jump into the pool. Like, that's the deep end. Yeah. You, by the way, survived through multiple deans and administrators while you were
And hurricanes,
Yeah.
multiple hurricanes.
Yeah.
So
Which was more, number of hurricanes or number of deans?
it's probably about, even.
Joann Strobbe, so nice to have you here. I'm actually really excited about this. Okay, longtime UNLV team member and glad to say friend. You've actually had a few different titles here. So rather than me, go through the titles, let's start with your background, and then we're going to talk a little bit about where you are now and that progression, because I think it's really interesting. But I'm super excited to have you here to get to talk to you for this. It's long overdue, I think.
Thank you.
So almost 3 decades at University of South Florida. Take us through that part first, and then your presidential role at UNLV. We'll get to that towards the end of this. So
When I got out of school, actually, I got my bachelor's degree and my master's degree while I was married and having children. So I was going to school and being a mom at the same time. So that was quite challenging. And I spent 10 years at Southern Illinois University.
Carbondale?
In Carbondale.
Yeah.
Always wanted to be in higher education. Loved it. But I was on the university side of the equation at SIU. And had just gotten my master's degree, and I had applied for a couple jobs down in Florida and was interviewed for basically the business finance director for the School of Medicine.
At South Florida?
Mm-hmm.
Well, okay, so let me go back just a second here. You grew up near Chicago, right? And then went to school in Southern Illinois.
Went to Loyola University initially in Chicago, and then went to Southern Illinois University.
And the job at South Florida was your first job out of your master's program.
Mm-hmm.
So this is amazing to me because you were at that job for 26 years before you came here. Like your first job.
My degree was in economics,
Yeah.
and then I got my master's in higher education administration. So after I got my I was in the accounting world. And then when I got my master's, that's when I was really able to apply for other kinds of management kinds of jobs.
Okay.
But my first real management job was in the School of Medicine at the University of South Florida.
That's a tough way to jump into the pool. Like, that's the deep end. Yeah.
And when I started there, I was the only female in administration, and I was the assistant dean of finance. And from there, the position grew. We created an academic health center, and we had, the School of Nursing, the School of Public Health, and so I was able to also grow in those schools as well. And really, all of academic health was really part of my finance world. So I was pretty much a finance person, and then I took on human resources and information technology.
So you had public health, medicine, nursing, pharmacy.
Pharmacy and physical therapy.
Wow.
And then they actually added sports medicine. They actually created, they moved athletic training into the School of Medicine, which was kind of a national model.
You mentioned that you were the only female in a executive position. Medicine was pretty male dominated at the time, right?
Yeah, and pretty much the chairs we had 16 or so departments at South Florida, and most of the chairs were male as well. We had a couple female chairs, but mainly in psychiatry or maybe in pediatrics. So it evolved over time. Even the classes were more 80% male, maybe 20% female.
Yeah, which is very different than our, we're more 50-50 here. So what kind of unique challenges did that present for you?
Well, I think initially it's sometimes having a voice and recognizing that just because you're not a practicing physician, that, the skill set that I brought to the table was finance and human resources. So it was, I had a different skill set. And when I was thinking about various mentors over the years, one of the physicians that ended up becoming a dean, he was a neurosurgeon, and he would always come to me and ask my advice, and I thought, this was the smartest man I've ever knew. He operated on people's brains for 7 and 8 hours. And I asked him, Harry, I said, why do you come and talk to me? He says, I don't know anything about finance. I don't know anything about human resource. You're my expert. I want you to stand up, and I want you to tell, the physicians what's important. And that really then helped me be stronger and less timid.
It's amazing to hear that story too, because the humility that he showed in that, and really
Exactly.
the understanding of, I heard a physician say one time, just because we've delivered 1,000 babies doesn't mean we know everything about everything. And, but that's not always the case, right? And so that kind of
These
humility.
are very, very smart individuals.
Right.
They have photographic memories, so you can show them a balance sheet or an income statement, and they'll remember every number on it. So it's not like you're scamming anybody. But that doesn't mean they know all the, guiding principles behind everything. So I did really appreciate, that kind of mentorship.
I want to talk about the journey a little bit more, but this point, like one of the things that I think that this is true about you from knowing you, service is very, very important to you, being in service of other people. Do you think that that's fair?
Yes.
And it's starting to emerge as you're talking about this, how you are in service and you create models of service within the organizations that you work. And so the mentorship, like you were just talking about, I can see how these things are starting to seed that. What other things was there early on that helped you kind of form this idea?
As I was also thinking about the 40-year journey, the internet and the technology grew up around me. We didn't even have cell phones when I was starting out. So it's amazing how much the technology, so it's this concept of lifelong learning.
Mm-hmm.
And it's never too late to learn something new and to adopt something new and to try to change. It's hard. We all experience that in our personal lives. But when you think about, even the, some of the new technologies still coming out today, there's just so much out there that can really change our world. But those were big steps. We didn't even have an internet. We had an intranet, so it was unbelievable, some of the technology growth and just being willing to take classes, to go and find out and learn more and try to figure out how we're going to move this into, we're not going to be taking notes anymore, handwritten, we're going to be doing it on a laptop. Even all that was just crazy new 20, 30 years ago.
So finance isn't usually known as a creative, service-oriented field, right? But you are. So where do you think that came from, and that idea of lifelong learning?
My mother died when I was very young, and my father raised us. And my father, a very competitive person. He was the football coach, the baseball coach, and my 2 brothers were in sports. And so we were very competitive, and we were into all of the Chicago sports teams. But, it was a very male-dominated world that I lived in. My dad also ran for mayor and was mayor, and so I was surrounded by, this competitive group of individuals who I loved. And so it just was part of that nature. If you wanted to have any voice, you had to learn early on that you need to speak up.
That's interesting. So you stepping into that world in medicine, male-dominated medicine, as one of your first executive positions, didn't feel completely foreign to you.
No. And I will say, for the most part, everyone I worked for, I really enjoyed. You know, there's always situations where something, you know, you're not going to be best friends with this person, but you respect them and you want to work for them. But I knew my father was a school teacher and my mother was a nurse. And I knew that I was going to be in a area of service. I wanted to serve. I wanted to do something meaningful. And my father would never let us be lazy. So it's like, you're going to work hard your whole life, and then you'll have a happy life.
Yeah.
Yeah.
Wow, that's great. So you played sports growing up.
I played golf and I played badminton. My dad was a golfer, so I played with my dad.
Nice. That's really special, isn't it? Getting to spend that time with a parent. Yeah. Yeah, that's really nice. And so take us on the rest of the journey. You, by the way, survived through multiple deans and administrators while you were
hurricanes, multiple hurricanes.
Yeah.
So obviously,
which was more, number of hurricanes or number of deans?
It's probably about the life of a dean was maybe 3 years for a while there, especially in South Florida. And even here, in the 7 years I've had there's been 3 deans. So it's just been one of those kinds of areas where a lot of times the executive is there maybe 3 or 4 years. And that was the case.
It was an early school, too, when you got there, right? Yeah. It's interesting. Early school, build out, really growing something from the very beginning. That seems to be kind of a common theme for you as well.
Yeah. And, there was about 125 medical schools for the longest time. And they weren't really growing that significantly. And then there was a bubble where a couple were being added a year. But even so, nationally, to only have 2 or 3 maybe new schools bubble up across the country, you got to really understand it's a really special thing to get a new medical school in your state and in your city and in your university. So when this opportunity in Las Vegas came along, it was unbelievable to really have the opportunity to go, really start at the beginning of a new medical school. That's just an amazing, thing to be able to be involved in.
Yeah, a new medical school in a very well-known city.
Yeah.
Talk a little bit about this, because you've got an interesting insight, right? You get to see it from the financial perspective, the service perspective, from a perspective that a lot of people don't get. So can you talk a little bit about what is so special about the UNLV opportunity?
Well, when I had been in Tampa at University of South Florida 20-something years, and I knew I wanted, one more big hurrah for my career. And I looked at Washington, D.C., and I looked at the AAMC and thought maybe there's a road for me there, because I was really thought policy and issues with women in medicine and those kinds of things were really important. So I looked at Washington, D.C. opportunities, and then I started looking at new school opportunities. And I was being a little bit picky because I didn't want to go into the cold, living in Chicago. It was like I really liked the southern half of the country. So I was being a little bit picky, and it was Thanksgiving. I was looking at the AAMC website, and I saw the UNLV CFO position. And I read it, and this was 2017, and I thought, wow, does that sound great? And my significant other at the time, Tom, has family out here, and we had been out here many times visiting his family members. And so when I told him that I was going to apply for this job, I think he thought I was kidding. And the other interesting piece is one of my former deans was the former dean at UNR, Bob Doherty. And Bob had always told me when he was my dean at South Florida that I would love to be in Southern Nevada, and that I would love this system. And I was always skeptical of that being out west, but he was right. It's been an unbelievable opportunity. So then, when I called the recruiter, Tracy Geiger at the time, who was a tremendous recruiter, and she really talked about all the great things about Southern Nevada and UNLV. I came out for an interview, and the other part of it was a female dean, and it would have been my first female dean, Barbara Atkinson. And, she had been dean at a couple other really significant medical schools. I had seen her speak at those medical schools along the way at the AAMC meetings. And so how cool was that to actually come and be able to talk with a female executive in the medicine world.
So Barbara was the first, I think the only dean, I don't know if this is male or female, but dean that started 4 allopathic medical schools, which is crazy to think about, really, that she's had that kind of an impact.
Exactly.
Yeah.
Now, I know I'm pretty sure she still is the only female that's been dean of 3 medical schools.
Yeah.
And she had, more roles than just being the dean. I mean, she rolled out so many large programs and hospital systems. So that was also exciting to come talk with her and have the possibility of coming to work, for her.
There are many things that are unique about Las Vegas, and obviously the Strip and so forth, but the culture of the city is different too. So I think, the story that you're telling and really your emphasis on diversity and equity inclusion, in regard to having a female dean, we're fortunate at UNLV that we've got lots of females in administration and executive areas, which I think is great. How do you find here what you've experienced here relative to what you've experienced before?
Well, part of it has been, the country's journey, but obviously it's been my journey as well. It's, for 40 years, when I started out in higher education, it was very male-oriented. The presidents were male across the country, and presidents of universities and deans of any schools. And so a lot of the positions that females had were in the human resources. Even in the medical schools, a lot of the associate deans held positions in the student affairs areas. And so in the chief financial officer world, it just was very different. And even going to school, a lot of my classes, I may have been especially in economics, I was many times the only female in the class during those, early years.
It's always interesting to me how there are things that we experience early in our life, like, for example, what you talked about with your dad, your family life, that prepare you for things that you had no idea it was preparing you for, right?
Exactly.
Along the way. I think that's fantastic. So you've mentioned, by the way, the AAMC a few times. Can you talk a little bit about it? And you've had some really significant roles in the AAMC too.
So I've always, as I mentioned, lifelong learning is so important to me, and the various medical associations that really support that learning development, I think, are essential. And the AAMC is great because they have a whole track for the finance officers. They have a whole track for the student affairs officers, the academic affairs officers, the compliance officers, the faculty affairs officers. So all the really unique components of a medical school, there is an association within the AAMC. So you can go there and really talk with other peers. And in this journey of going a couple times a year to these various meetings, to not only see all the great places there are to visit in the United States, but also really to meet all my colleagues. And one of those colleagues that I met at a AAMC meeting is my current husband, Tom McQuarrie, and he was working at the University of Cincinnati and was at the medical school there, and he was a planning officer. And so they decided that wouldn't it be great for the planning officers and the finance officers of the various medical schools to get together and talk about facilities and finance.
So have you found the person that made that decision and thanked them?
Yeah, so it was kind of cool. And the dean at the time, like the next year we went back, and when Tom moved to South Florida, the dean of the medical school, he always took it, the one that's my mentor, Harry, he always would remind everybody that, there's a lot of things that can happen at the AAMC meeting, including finding your spouse.
So Tom's an architect by training?
Mm-hmm.
Yeah, super good guy too.
Thank you.
That's a really cool story that you guys met. And now he goes to the AAMC and he has I guess he has an official role as an ambassador.
He is an ambassador, and he knows probably more people than me. So it's good to have him at the AAMC meetings.
Yeah, that is fantastic. So let's take a time out for the journey for just a second. I want to kind of put this in perspective. There are a lot of areas that have come up already: service, DEI, lifelong learning, and so forth. What would you say is your North Star and some of your guiding principles that you have? Because I think this is going to be interesting as we go through the rest of the story to see these things come up.
I really believe with my heart that you can do all these things and be successful and be kind. I've never been, I just really believe that we should envelop kindness in everything we do. And, I feel that if it's kind of my North Star, it's like, how would you want to be treated if you were sick? How would you want to be treated as a student if you were having a difficult time? How would you want to treat somebody who worked for you? How would you want to treat a family member? So it's part of my thinking is how to really make a positive, kind environment.
I'm going to say this, just having known you all this time and worked with you in strategic plans and all these other things. It's beautiful what you just said. It's beautiful to hear this, but it's not surprising because that's what you've done.
Thank you.
When I don't know if I've told you this, but when we had the last strategic plan and we were the people, right? It's HR and compliance, faculty affairs, and so forth. And you came up with the acronym of service for everything that we did, and which I thought was really clever. But now hearing you say what you're saying, right? That it's not just serving, it's being kind in service to other people, which, I think maybe sometimes we forget that in medicine and training individuals to be physicians and to contribute to healthcare.
It's not easy. I get, in my current role, I'll get a letter from somebody that, they had a bad experience, and I'll read through the letter, and I'm really touched because something didn't go well in their healthcare experience, and a lot of times it involves people. And it's not easy when you're having a hard day and something isn't working right, and maybe somebody who you're sitting next to isn't being very nice either. There are a lot of things. And then you're abrupt or curt to a patient who also isn't having a good day, maybe very sick. And then we didn't really live up to that person's expectations. It's very hard to teach empathy and kindness. And sometimes you just know when somebody can't learn that trait. It's something that they have to have inside.
It's a friend of mine told me one time, she's in healthcare, and she said when she's working with a patient, she looks at that person as if it's a family member who she loves dearly. And she tries to treat them with that level of compassion and empathy as she can. And I know that there is a reality to this situation.
Certainly is.
But I think sometimes the pendulum swings the other way, right? Too far into how many people can we get through, being very matter of fact about the vulnerability and the issues that people have. And so hearing this, and again, I'm being stereotypic, but hearing this from a person who really the background starts in economics and finance, those things don't sound like they go together, right? But I'm very happy that they do go together in your case, which means in our case as well.
I once had a surgery chair get up from my office, and as he was leaving the door and he was shutting the door, and he turned around and he said, "I just want to tell you," he said, "I've never had no said to me in such a nice way ever as you said today." And I said, "Well, thank you, Dr. Carey." And he said, "No, I'm serious." He said, I feel like I should be upset or mad that you said no to my request, but I'm leaving and I'm happy." And I said, "Well, I wish I could fund everything. I just, there are days when we can't, say yes." So
Yeah.
it doesn't have to be nasty. It should never be nasty.
Yeah.
Yeah.
Yeah, we've talked about this, the idea between competitive and cooperative communication. And cooperative is so much about looking for opportunities to have agreement or
Exactly.
doesn't mean you're always going to agree.
Exactly.
But you look for those opportunities. And I think, what I hear you saying is a lot of times people forget to look for those opportunities.
Well, you can't always support every recommendation, and you certainly can't afford every recommendation that comes forward. And nor is every project or recommendation worthy of, moving forward on. But how you, analyze that, evaluate it, and then relay that information to somebody, again, that doesn't need to be. People make it more difficult than it needs to be. But it needs to be direct, and it needs to be kind.
So you've got a lot of decisions that you need to make, originally for the School of Medicine and now for the practice plan and the school. You're president and CEO of the practice plan, which is, I'd like for you to talk a little bit about how the practice plan and school works together, and you're senior associate dean for finance for the School of Medicine, right? Can you talk about those roles and also how typically a practice plan and a School of Medicine work together on a similar mission?
In most public schools of medicine, they do have a faculty practice plan that is a separate 501c3. It's a nonprofit corporation that has been established outside of the university structure. That gives them a couple areas of strength, because then you can still negotiate contracts with outside payers and insurance companies and keep some things out of the sunshine, where in a state environment, everything is really in the sunshine, or really has to be disclosed. So you can really conduct a business separately that you need to in a separate 501c3, which is what UNLV Health is, a separate 501c3 corporation.
And it impacts the liability issues as well, right?
Exactly.
Yeah.
And so we also, at UNLV Health, we hire all the clinical individuals that really are employees of the medical clinic, so the medical assistants, the RNs, the front desk people who check you in, the people who check you out, the phlebotomists, the people who are the sonographers. So we have 450 employees outside of the School of Medicine that really work for UNLV Health, that are the clinical individuals that work for the physicians. The physicians are our faculty for the School of Medicine, and they are all employees of UNLV. And the UNLV Health then buys out their time so that they can really do work and serve in our medical clinics for UNLV Health.
So one of the jobs of physicians is to work in the clinics to generate revenue, which goes to the practice plan, which eventually comes back and pays a good portion of the salary for
Yes.
that faculty member.
Yes. Unlike many faculty in UNLV, our faculty, the clinical faculty, probably contribute 70% of their salaries by providing this, health care outside of their teaching responsibility.
Having come from main campus, this was an interesting conversation because the salaries of physicians are typically higher than traditional academicians. But the actual amount of money that's given from the state
Is more comparable.
Because the additional salary is really generated from that individual working in a practice plan.
Mm-hmm.
Yeah, it's a
And you
different
really
model.
do need physicians, teaching physicians, and really providing their expertise, both at the bedside, at the hospital, in an ambulatory setting, to really have a good experience and really to be accredited for your medical school.
You taught as well when you were in South Florida, correct?
I taught a business of medicine whole section, and really the nuts and bolts about if you want to have your own practice when you get out of medical school, what does all that mean?
Yeah, what do you think are some of the I was going to say shortcomings, that's not really fair, but the places where there's a gap in knowledge for a physician who comes out of their training and now they're going into private practice from a finance perspective?
There are so many complications and so many compliance standards and regulations that you have to follow in today's world, not only the privacy component of it and how you protect patient records, how quickly those patient records must be available to the patient, all the various billing codes that you have to know and understand and bill to the federal government for Medicare and Medicaid, and all of their, obviously, federal and state requirements that have to be met for you to be able to bill, and then negotiating with all the commercial insurance companies of what rate they're willing to pay you, because they will pay you different than they would pay somebody down the street. So you really have to have a business savvy to be able to open up a practice and really enjoy that component of it. Physicians, join larger groups because they don't want to worry about how do I hire a medical assistant and what kind of benefits do I need to provide to that person. And they let a corporate entity really run the business component of it.
It's so interesting to think about, and I'd actually, if you could talk a little bit more about this, you've got two practices. They are negotiating with insurance, with payers, basically, insurance companies, and they may get different rates.
Absolutely, in the same town.
Yeah. And that's one of the issues that we have in Las Vegas relative to our neighbors, right? The reimbursement rate that we have for our physicians versus, say, California or Utah or so forth. Can you talk about that a little bit?
In every area, there are different payers and insurance companies that have more prevalence, and they may even dictate the market. And one of the things, that your payers, they want to make it clear that when they do business with you, that contract is confidential. So you really aren't going out and publishing your rates that you're getting either. So part of it is just knowing that if you're going to pay somebody a certain salary, then the revenue that they generate has to support that salary, or they can't stay in that market. And that's where Vegas has been somewhat challenged, because I even saw yesterday a recent speaker who spoke on physician wellness, but we're still in many areas 48th in the country out of 50, the number of physicians per capita. In most disciplines, there's a workforce shortage of physicians, and in Nevada, that's particularly true. And one of the reasons is the ability to get docs here and pay them some of the salaries that other markets are able to pay. And some of that has to do with, what you're being reimbursed for services.
Yeah. Yeah, I think that really, we're growing our own here, and I think that's a big thing. But really, if we can recruit people into the city primarily, then we need to do that. To your point, we're unfortunately at a low accessibility to physicians.
Well,
Yeah.
I think I'm going to repeat what the dean said. If you go to medical school in a state, you're 40% likely to stay in that state and become a doctor. If you go to medical school in a state and then do your residency in that state, you're 70 to 75% likely to stay in that state and practice medicine. So we are not only trying to grow our medical school, but also trying to grow our residency, so that after medical school they can choose a residency that they're interested in and stay here. But for example, if they wanted to be an ophthalmologist, they would not be able to do their residency currently in Nevada, because we do not have a residency in ophthalmology. We're trying to work on that with some local individuals, but those are the kind of things that that this state deserves.
Mm-hmm. It makes it, when you talk about opening a medical school in a state, based on what you just said, you can see even more so how really important it is to be able to do that. So there's some good things and bad things about medicine right now in the country. You know it from a lot of different perspectives. So let's hear your list of good things about medicine right now and bad things about medicine right now from your perspective.
Well, good things. There still isn't any other country that I'd want to be in or be at if I was, ill, or if I needed, help for a family member. I'd want to be in the United States. I think we're still, on top when it comes to innovation and technology, and really the kinds of accreditation standards that you would want. And even when new schools are opening up internationally, they really look to the United States for their accreditation standards. So I think that still speaks volumes to, the kind of training and education that we provide in the United States to medical students. The other really great thing that's happening now is really AI and some of the advancements in artificial intelligence and what's happening to really make the experience with the patient more efficient. And I'll give you an example. We've been test piloting a new product line from Epic, which is our electronic health record. And this is really taking the interaction a doctor has with a patient and recording it and then summarizing it and putting it into the patient's notes, so that the doctor, would normally have to spend hours after the day is over recording all of their notes. and entering all of this into the patient's records. And now it can be done through AI, and then the physician can read it, make sure it's correct, and then press a button and have it really entered into the medical record. That saves a lot of time for a physician to treat patients and illness, rather than some of the clerical things that have to be done to really make sure that medical record's concise.
It's interesting. So I'm excited about AI in medicine as well. Initially, I was thinking about it from for example, a surgical perspective, right? Using AI to assist with surgery, to be able to look, for example, at cancer and find out where the lines are, where the cancer stops and the good cells begin. So from that perspective, but thinking about it from the sort of operations perspective, I have no idea where AI is going to go, but I do know that there are some great applications, just like the one that you talked about.
Well, and thankfully the, airline industry has been in this world a long time, because without that, they want 100% or, everything, and that's so that we're all safe when we're flying an airplane, and we should be able to have 100%, air-free instances in healthcare, and it's going to take this kind of technology. The scary part still is the privacy issues that go along with AI and the technology component of keeping everything protected and safe. And so there's still a lot of human interaction that has to occur, and really to make sure that we're not overstepping that line. And so there's that good and that bad part of AI that is coming, and it's how we're going to regulate it and how we're going to embrace the, fantastic new ideas that can come from there.
So what would your AI bucket list be if you could, say AI can help us with these things? Any thoughts?
Well, certainly the medical record component of it, I'd like us to be early adopters in that world. We've been testing it out, and so I'd like that. The other area that I really think could really be significant is in the whole imaging world. Only what I've read, because again, I'm not a doc, but that what they can detect in some of the images, especially for that where there might be bad cells or cancer cells, is really spectacular. And so that the naked eye may not be able to see it as readily as some of the AI is able to do. And then you can have a physician look at it and validate. But sometimes you can't see that as well as a machine can see it. So it's I think those kind of advances are every day just getting better.
Yeah, one of our surgeons, Dr. Randy St. Hill, talks about how helpful and accurate the AI systems are already in regard to cancer detection, which is, I agree. Okay, so I'm not going to ask you the bad things. I'm going to ask you what things could be improved from your perspective, from all the way across medicine. This could be from the finance perspective, the humanity, the et cetera. What do you think?
If I could improve and give us 5 stars on something, I really would like it. I'm going to talk about access. And that is 2 areas. First of all, there's just getting through on a phone to somebody. And so you're trying to find your doc, you're trying to get an appointment, you're trying to maybe you have a referral from a doc to another doc. Really trying to make that as easy as possible for a patient, is really my number one vision. And in some instances, AI is going to be able to help with that. People aren't always crazy about, the systems where they call and they say, press 1 for this, press 2 for this, press 3 for this. but they're becoming a lot more sophisticated where you're almost having a conversation with somebody on the other end. And so it is, I'd like to make an appointment with Dr. Smith, and the AI on the other end, you know, can actually talk to you about that and help walk you through that. So I would really, there are systems that we've looked at. Again, a lot of that, and when they first come out, are very expensive. And so you know, you have to decide how we're going to roll those kinds of things out within the resources that you have. And the other part of access has to really do with growing our physician group. We have about 150 practitioners and 20 or 30 advanced practice providers. I would really like, you know, we're trying to recruit 30 right now additional, but I'd really like to have 100. You know, I always say, I want 100 more.
Yeah.
We need physicians in every area at UNLV Health and the faculty at the School of Medicine. It would just really cement, you know, us in this community at every kind of discipline, and that's really what we need.
Yeah, it goes back to service, right? We would be able to serve our community and serve our mission as well, that, you know, we are improving healthcare in the state of Nevada.
In some instances, we only have 1 or 2 docs that are available. And so the wait times are 3 and 4 and 5 months. So again, back to access. You know, you want everybody to have the access they need for their wellness. And to me, that I think about that every day. You know, to make a community healthier, you need to have that kind of availability.
I think the other part to this, and I don't want to put words in your mouth, but I think that you believe this as well, that, you know, obviously the physicians are important, but the people who support the physicians are important as well. And that whole organization, that ecosystem of people moving forward, like making appointments, right? That sounds simple, but that can be a bottleneck a lot of times. And if we can...
The entire business operations team at UNLV Health, the clinical operations team, it takes a lot of individuals with a lot of experience in healthcare, and many of them we've recruited from outside the state to bring here and to bring their technical experience. So I want to find individuals here in Southern Nevada. I want to get them in our systems. I want to keep them. I want to train them. I want them to grow with us, and I want them to really choose UNLV, UNLV School of Medicine, and UNLV Health as the employer of choice. And that's my goal. And then we're keeping people here and keeping them excited about their job. I think then we'll have, you know, the best healthcare delivery system, you know, in Las Vegas.
Yeah, it's a moonshot goal, which is exciting, right? And so this goes back to you building from the ground up, right? These are things that is one of your drivers, one of the things that you like, right? One of your North Stars is to be able to build. I think the thing that is one of the things that's unique to that, because there are a lot of people who want to build, but you want to build in a service way, right? Not just build to build, right? You're building to create better service for individuals and the medical field in their most vulnerable state.
I love being in a growth mode.
Yeah.
And we're not just growing to grow. We're growing because it's going to serve a purpose.
Yeah.
And there's a need. And so it's really important to assess that need. And there is a really strong need in Southern Nevada for improved health care. And there are really a lot of good individuals in this market. It's not just UNLV. There's a lot of strong individuals. But we're going to be one part of that, you know, healthcare front. And, you know, we're not going anywhere.
Yeah, and we do, and all of those groups need to work together as well.
Yeah.
So when you moved here in the first place, or when you were thinking about moving here, did you feel like you were taking a chance?
Oh, yeah.
Yeah? Tell me a little bit more about that.
Well, you know, when you're working for a place that has, you know, USF even though it started out relatively newer, it had gone into the top 50 of medical schools, and it was really had a strong reputation. And so really there was a lot of, from outside, there was a lot of things going on with the creation of the medical school in Las Vegas. And so there was a lot of press, and there were a lot of people moving in and out of the market. So it was a little scary to think about, is this really going to happen? Is it going to survive? Is it going to stay? Is it going to get accredited? Is the state going to support us with the resources that we're going to need? Are we going to be able to recruit and retain individuals? And the bottom line was really, it was a leap of faith. And there were, 3 or 4 individuals, including Barbara, that made me believe we could do it. And it's part of that, I guess, brain. It's like, I didn't come here to fail. Mm-hmm. I came here to really make a difference.
Yeah.
And so it's like, I'm not going to leave until I made a difference.
Yeah, your dad was not going to let you not work hard and quit.
Exactly.
Right, yeah. So which was scarier to you, coming here or jumping out of an airplane?
Well, I've only jumped out of an airplane once. I have to say, I've done some things once, and I'm happy that I did them, but I wouldn't do them again. And if I had to jump out of an airplane to save my life, I could do it, and I know I could do it. But coming here was a leap of faith, but it was something that I'm just so thankful that I had the courage to do it.
So one of the things that keeps coming up again as well is this not challenge, but the value of challenge, mm-hmm. right? I kind of see you seeing coming here as a challenge that you wanted to accomplish.
Well, the other piece of it, my whole life was in Tampa. I have 2 sons. I have grandchildren. I have all my best friends, people that I grew up with at the university, and other lifelong friends that I had made. And so it wasn't just leaving my position at the university. It was also leaving a family, mm-hmm. Leaving, my home, leaving individuals that I really care about. And so part of that is really believing that what you're going to go do is really important.
I always believe that it's a great thing if people are running to something instead of away from something.
Exactly.
And so I love hearing you say that this is really, you were running to something because you saw the challenge and you saw the opportunity, and it's been a good experiment so far for you, right?
And when I called people to say, oh, guess what, I'm leaving USF and I'm, moving to Las Vegas. So like, oh yeah, you and Tom, you just want to go there. You like going to the casino. It's like, no, I'm going to go there to open up a medical school. And people were shocked.
The first year that you were here and we went to the AAMC conference, it was remarkable to me how many people knew you. And Tom, by the way.
Yeah.
But how many people knew you. So yeah, you were very much embedded in nationally as well as at USF. So yeah, it's a big move for you.
I had been a national officer for the Group on Business Affairs. Mm-hmm. I had been a national officer for the senior administrative finance officers for the academic health centers. So I had been in several leadership roles with the AAMC. So I had, as I mentioned, I had really embraced that learning development side of the equation, and that's the other piece I thought would be really helpful to bring to Nevada and to Las Vegas, because we were going to have to go through all the accreditation standards, go through all of the kinds of jumps and hoops that every other school has to go through. So it's good to have some individuals that that you can call and say, hey, where can I get research on this? Where can I get help on this? Do you know a good policy on that? And I think having that component was also helpful for me.
Absolutely. And you've worn so many hats that you've been here. I mean, let's talk about some of your official hats and then some of your unofficial hats that you've worn here. We just talked about your current role as president of the practice plan of the UNLV Health. Mm-hmm. Walk us through from the beginning that you got here, your official hats, and then we'll go to the unofficial.
The first job I was looking at here really was the Associate Dean of Finance. And that really was coming on board and really taking over the financial component of the School of Medicine. And that's what the position Barbara talked to me about. Shortly after I got here, there was kind of a reorganization, and that's when I was asked really to take on human resources, facilities, IT. And so that's when I really became Associate Dean for Finance and Administration.
And you had been over that same group
Yes.
at USF.
Yes.
Yeah.
And at that point, too, the practice plan hadn't gotten its first audit yet. It was really in its first year when I came on board. And then we had the first year we had a little bit a difficult audit, and Barbara then went to the board of directors of the practice plan and asked if I could be made the chief financial officer for the practice plan.
So at that point, not leaving the school, but adding the practice plan.
Yes.
Yeah.
And so at that point, then I would spend several days a week at the practice plan, really going over their finances and working with the then president and CEO.
This was critically important for the school because if the practice plan isn't viable, the school isn't viable.
Correct.
Yeah.
And to really recruit the faculty necessary to grow the class size and to really then secure the medical school, you really have to have more physicians. And then the physicians really had to have a place to practice. So it was really important that the practice plan really be a strong entity financially.
Okay. And then next.
And so then really, I think that stayed like that for a while. And then when there was another reorganization, that's when they asked me really to take on the president and CEO of the practice plan. So it was kind of an evolution.
Those are your official hats.
Yeah.
Let's talk about a few of your unofficial hats. I know that you are the party starter for the school. I think the things that you've done, like, for example, putting together the, bringing together the practice plan and the school for an annual social.
I think it's really important to develop the culture.
Mm-hmm.
And I didn't feel good about us being divided or feeling divided, that the school somehow was different than the practice plan, or the practice plan employees were different than the school. And so I really wanted that feeling that we're one, and we're here as a unit. And so I thought it was important to start doing. You did too. You felt that way.
I did,
always.
absolutely.
And so it was like, how do we do things, as a group that really puts down those barriers?
I mean, it's faculty affairs, right? In most institutions, they serve the academic faculty of the institution. But I've always believed one of the things we've had in common is that why would we only serve one group?
Right.
Let's serve everybody we can serve.
Exactly.
Right.
And I always appreciated that because there were some barriers we had to break down and some feelings of us and them. And it's to have that going on internally, we didn't need that. We really needed to feel like we were all UNLV.
Organizationally, there's some utility to having some degree of separation between the two, but there are other places where you really don't need that separation. In fact, it helps not to have it.
Exactly.
And one of the things that's really interesting, in that whole model is us versus them, and yet the a significant component, the physicians, are in both places. They have a foot in both worlds.
Exactly.
And so it's not even a 1+1 because you've got some significant overlap. I think that there's been strides made there, and I think we can continue to do an even better job. This most recent strategic plan, you know, we're considering the entire organization instead of doing two separate ones. That may seem like something on paper. It's not. It's philosophical. It's you know, it's something just like you're saying that you bring it together as one big organization. And I think you know, we both agree on that.
Well, and you know, matrix organizations, and we probably, you know, should write about this sometime together. But you know, they're really complicated. And in the mission of the medical school, and you know, the students are our number one. You know, I can say that 100%. The practice plan, patients are number one. But they go well together because you can't be a good doctor if you don't know how to treat patients well. And treating our students well and overlaps to treating our patients well. So there's lots of pieces to it that even though we have, you know, different missions, but we're serving the greater good.
I'm not going to disagree with you, but I'm going to add on top of that. I think our mission is improving healthcare, right? We go about it in the school and the practice plan two different ways. In one case, it's being frontline and doing that. In another case, it's essentially investing in individuals,
Good
right?
point.
So that we can do that.
Yeah.
And I think what that allows us to do is, and this is a perspective, but I think it's important that if we understand that we're all serving the same mission, then it's not an us versus them. It's a how do we work together and how do we support each other to be able to do this?
And we are a business, and healthcare is a big business, and it's a big, complicated business. But in order to be a good physician, you have to understand the business component of it. And so to me, really operating in a business setting in the healthcare arena for a medical student is essential. So they can see what it's going to take for me to really do well as a physician and make a good living.
Right.
All those pieces have to be lined up.
Yeah. Make a good living, be a good person, do good, be good, all the way through. It's one of the things where, like, one of the programs that I know is important to you, the Walk with the Doc program. It's so simple in concept, but it's a really important program. Can you talk a little bit about this?
So one of the executive leadership individuals, our executive director, Zena Jacobs, she came from Kansas, and she did a lot of great things in Kansas before we were able to convince her to come to Las Vegas. But she really had been talking to me for several months about a Walk with the Doc program. And initially I couldn't think of, I really thought, well, you know, this will just come and go. But not if you're committed to it. And so one of the first things we did was really say, we really want the team members to be healthy and to really consider wellness. And what better way to do that is to walk on a Saturday morning and also get one of our docs out there to have, you know, a little time with the staff to say, you know, something really important about that person's passion. So, you know, we've had a doc talk about blood pressure. We've had a doc talk about sleeping disorders. This past October is Breast Cancer Awareness Month, so we had the Bonosas speak about breast cancer. And, you know, it's become part of who we are now, that it's like we're going to go out and walk, and we're going to, you know, really think about how important this is for our health and our patients' health and for our doctors' health. So.
It's one of the things I like so much about this program is it is about humanity in medicine, because anybody can come out and walk with the doc, right? They can see who's walking, what the topic is, and just go have a conversation. And in today's world, just having a conversation with a physician about a topic that you care about, that's hard to do.
The Walk with the Doc program is a national program, and they're sponsored, you know, activities in cities all over the United States. And so there is a Walk with the Doc newsletter. And so you also get information from across the country on different things. And in our third month, they were so shocked that our dean, decided to come out and walk, that they sponsored us in their national magazine.
Oh, that's great. I didn't know that.
Yeah, it's like Las Vegas is out there, even got the dean of the medical school out there walking. So, that's what's also great about being in a area that isn't afraid to challenge just the everyday. Well, why not walk?
Yeah.
Why not get out there? It's not something we don't have all these age-old traditions that we're trying to fight. It's like, let's just go out and do it.
It's one of the things I love about Las Vegas and the West in general. It is a little bit Wild West still.
Is.
And mostly that's a very, very good thing. And I love the attitude about it as well.
Well, when you recruit, you have to remind people, we talked about this earlier. You have to know you're going to a place where it's not all lined out for you. You're going to have to make your journey here. And there are some instances where you might be the only person, and you might be the only person that can save somebody's life. Mm-hmm. And sometimes that's scary, and sometimes people aren't ready for that yet in their lives. So I always try to be very honest with individuals that are coming here, both in the administrative side and on the physician side. This is a leap of faith, because you will have the ability to create the future.
I think that's exactly right, and I love that. You will have the ability to create the future, your future mm-hmm. as well. And I think, one of the things, so I know that Vegas is not right for everybody, because some people like a box, like mm-hmm. it put in a box, right? And it's not, I don't think this is unique to Vegas. I think it's in general, the Western U.S., but Nevada in general, but specifically. But for the people that it's right for, it's great mm-hmm. for those people, right? Mm-hmm. And the ability, the thought that you can create your own dreams to come true, you don't get that very often mm-hmm. in most places, right? You typically are a cog in the system. And here, the flexibility and the creativity that you can use. I mean, I think about some of the things that you've done. Fortunately, you've never been in a box. You've gotten to do some things that are probably pretty unique that you couldn't do that if you were in a very, very well-established, carved in stone kind of medical school.
Well, I think that's the case with our new school and our new practice. I mean, we've really been open since 2017, but that's really young. Mm-hmm. There's just a lot of places to go.
So I'm going to ask you, on these podcasts, we usually ask moments of joy. I'm going to ask you two versions of this. With this across your entire professional career, what are some moments of joy that you can remember that come to mind from your professional career here or previous to here, which isn't as important as here, by the way?
The moments of joy here, they happen regularly because we're so young. The first time this happens, or the first time we've done this, or the first, we celebrate when we hire a new doc, mm-hmm. Especially one that, when we hired our first rheumatologist. And so those are small joys, but they're nevertheless, they're really important. So just that piece of it is critical. When we got accredited, the school, that was a milestone that, everybody worked hard for. And to really see it on paper, you felt it when they were here, when they talked to you, you felt that you were important in the cycle, and that, and you could see it all lining up. But then to finally get the piece of paper that says you're accredited and we won't be back for many years. It's really an accomplishment to be able to open those doors, mm-hmm. to have, we just put our financial audit to bed. We got a clean audit. We're in the black. Those are moments of joy here that get celebrated regularly because we're so young. And it's not like, oh, we've been in the black for 50 years. No, this is something that we've earned, that we've had to move forward to do. So it's many things here because it's all so new.
Yeah.
So professionally, I really, really having the complete team at the practice plan. I think we have a really solid executive team. We have a really good board of directors. I really feel like we're starting to really make a significant impact in this community. We've opened up our new facility up at Tenaya Way. It's a beautiful facility. There's going to be some additional facilities we're going to open up in the next 18 months. Those are really accomplishments that I think are significant.
And I think I agree with you that some of this is because we're new and they're new. And then some of this is what we talked about before. It's perspective, because we do celebrate moments of joy. And so people look for moments of joy, which I think is great. Okay, so for you personally, moments of joy in your life.
I have 2 sons that I'm very proud of. And and having children, as you know, is a part of your life that, you can't explain. Having grandchildren is a whole nother level of happiness. So, because you don't bear all of the responsibilities, and so you bear a lot of the fun. So I will tell you, I love being a grandmother. They call me Jaja because we had to come up with a good name for their grandmother, and I was being pretty picky. And my friend, who is Greek, she's a Jaja, and so she's a Yaya, and she said, you can't be a Yaya. You have to be something else. And so we came up with Jaja, and so that's what my grandkids call me, and I love being their Jaja. And so that was really, having my 2 kids grandkids are just the most special moments of my life. And then Tom and I actually got married here in Las Vegas right after we came here, and that was just a wonderful experience. All my family members came, and it was really, to move to this city, to really, start your new life, and then, to get married. It was really
I'm glad you said it,
wonderful.
because I was going to bring it up if you didn't. That was a great
And it was
wedding.
a good party, too.
It was a good party.
It was a good party.
Yeah. So, okay, Jaja as in Jaja Gabor? Yeah.
Yeah.
Okay, spelled the same way? Yeah, that's fantastic. You made me think about my oldest sister and brother-in-law, who they've been married forever, so he's basically my brother as well. They say the same thing about grandkids, and you made me think about this. It's kind of like getting a muffin and just having to eat the top, right?
Yeah. It's great. I love it.
Okay. Favorite restaurants in Las Vegas?
Well, I'm a steak lover. I like Circus Steakhouse. I like Golden Steer Steakhouse. But my brand new steakhouse that I like is Carver Steak at Resort World.
Now, Carver used to be on Paradise, didn't it?
I don't know.
Oh, if it's the same place I'm thinking of, it's really good.
Carver Steak, it's high end.
Yeah.
And it's probably double the cost of the other 2, but it's great. Great steak.
Okay, so your grandmother was Lithuanian, correct?
Correct.
And I'm going to spell this because I don't know how to pronounce it. Benld is the town that she lived in. So
What's your favorite restaurant?
that's a good question.
It's a hard one.
It's a hard one because there's so many.
Because I like steakhouses, I can narrow it but there's so many other good opportunities.
There's a new sushi place that's very close to here. And it's funny because I know more about the chefs and where it is than I necessarily know the names. So Other Mama is one that I really enjoy. The chef has become a very good friend.
Is that in downtown?
No, that Other Mama is actually, I think I confused myself in the story. Other Mama is on Durango and Twain.
Okay.
And they just opened another restaurant right there, which is sort of a Spanish-themed breakfast place.
Wow.
Yeah, it's very good. And the name for the breakfast place is Spanish for shaman, female shaman,
Oh.
which of course I don't remember the name. But the sushi place, which is, I don't know, a mile from here.
Really?
The sushi chef, yeah, so if you ever go to the Smith Center, it's right there. I'll get the name for you. But the sushi chef grew up in Cambodia, I believe, and then immigrated as a child as a refugee to the U.S. And then was an elite level soccer player, played collegiate and so forth, and then just decided that he wanted to become a chef.
Jeez.
Yeah, and the sushi is fantastic as well. Other Mama's sushi is excellent too, but they have a lot of different things that they have. I think it's hard because I would have to do genres like okay, this is my favorite steak place and this is my favorite Italian and so forth.
And I realize because the dean is such a connoisseur.
Oh, he
that
knows
I
a lot
haven't-
of restaurants.
My gosh. I thought Tom and I went out
Yeah.
regularly. He probably eats out 3 or 4 times a week. So the places he's touched that we haven't even
Yeah.
tried, and he, speaks such highly of, even if it's Ethiopian or, various kinds of Asian food, it's amazing.
It is really remarkable to me that he is just so open to try so many different places. And I actually trust his food reviews as well. Like he'll say, it's not really worth it, or this place is great. And so far he's batting 1,000 for the places that I've been to with
Well,
him.
the last 2 times we've gone out to dinner with him and Tom and him have settled on, they always order the same thing. And so then they've decided that they're not going to order the same thing. They narrow it down to 2 things so they can share. So
Yeah.
I don't share with them because they want to do seafood and all that kind of stuff. And I always, of course, want to do the beef. So now my husband and my boss, they've got this, food sharing arrangement. I'm like, oh, great.
You know what? I don't know if this is from coming from a big family or not. I always share. It's like, even, it doesn't matter who's at the table. It seems like, how about you get this and I'll get this? And then when the waiter comes, it's like, just put it in the middle. We're
Yeah.
fine. Yeah. I
That's
love
fun.
doing
That's
that.
fun, too.
Yeah. I'll have to think about it. It's funny, I asked that question about favorite restaurants, and I don't
It's
usually
hard.
think about it.
But because it's my favorite food, they're my favorite restaurants.
Yeah.
That
So the Carver, if it's the same place or same, is very, very good.
really good.
Yeah.
Yeah. Especially, I like a ribeye, but even there, Tom's had the New York strip. It's really good.
I will tell you a place that's not too far from us, Harlow's. Have you been there? They have a warm seafood tower there that is absolutely outstanding.
See, I think I might I'm not a cold seafood tower. Tom loves cold seafood, so sometimes he and the dean have split that. But I like warm shellfish.
So I'll tell you the pro tip on this one. You go get the seafood tower, which is fantastic. The sauce that it's in is just crazy good. And then when you're almost done, order pasta, and they will put that all in the pasta, and it becomes the sauce for the pasta. And some of the seafood's left. It is amazing.
I bet. Oh,
The
Tom will
martinis
love that.
aren't bad there either, by the way. So
Well, I had a martini at the bar before we went to David Jackson's, and they do make a nice drink there.
yeah.
They certainly.
I had
do.
one before I came here today. So, okay, so I asked you about restaurants. I understand that if you were not in your current industry, you would want to own a restaurant.
Well, probably a bar.
Yeah?
I would. I always thought that I would like to have a beach bar. Where people are on vacation, they're
Yeah.
happy, they're drinking, they're having fun, and you're making them exotic drinks, and they're telling you all their fun life stories. So I always thought that'd be fun.
Now, would you be in like a finance role or working in the bar?
I'd like to work in the bar.
And how about Tom?
Tom would be the greeter. And, I'd probably put him to work too, but he's if we had any food, he'd certainly be the chef.
Yeah, because he's a
great cook. But
Yeah.
Tom can talk to anybody.
Mm-hmm.
I mean, at all walks of life. And Tom will talk to anybody and make friends with anybody.
Yeah.
And he's got that talent. Some people just do, and he does.
Well, and he's genuine about it too, which is so nice.
Yeah.
Yeah.
And he can, some of the things he'll say to somebody that we'll meet at a banquet or something, I'm like, oh my God, what's he saying to that person, who's a vice president of this big company? But, he's very genuine.
Yeah. Yeah, that's fantastic. Well, Joann, this is a blast. We get to talk to each other all the time, but not this way. So this is really fun. Thank you so much for being here.
It was great, and we always have great conversations that seem to go on forever, and I'm glad we were able to do it today in an official capacity.
Me too. Thank you so much.
Thank you so much.